In this video, I will talk about 10 important questions every woman should ask their gynecologist from the age of the teenage years to 30. Stay tuned to learn much more. Welcome to Women's Healthcare Answers, and this is Jeff McQueary. I am a practicing gynecologist in Tennessee. I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can with answers and solutions I will give you. Today, I want to talk about 10 important questions every woman should ask their gynecologist from the teenage years to 30. This is really a very important time of your life, and I know all of you have these questions. Stay till the end for a special bonus question and answer. Let's get started. Number 1, is there anything I can do to be more comfortable during my GYN exam? You know, often a visit to the gynecologist is not a woman's favorite thing to do, believe it or not. It is often compared to the dentist and pulling teeth. But really, it's a no judgment zone. Your gynecologist should do everything to make you feel comfortable by taking you first back to the room and talking to you first fully clothed, and then fully explaining the examination to put you more at ease. This is one of the most trusting relationships you will ever have, and it is important for even to ask your friends about a gynecologist that they really like and trust. Number 2, how do I do a proper breast self-exam? Well, the main thing is don't wait until your yearly exam. Check your breast every month after your period. There is some controversy about whether this is helpful, but I recommend it. A study in the Journal of Women's Health found that 64% of women self-detected their own breast cancer. So it's important to know what your breasts feel like, not to be overly concerned about it, but just so that you know what normal is. Make sure and feel all the way up to the collarbone and all the way over the breast and even your armpit area for changes. If you feel anything different, it could be abnormal and you need to bring this to your doctor's attention. The main thing to understand is self-exams can help you detect breast cancer in very early stages. Your physician can help show you how to do a proper examination. Number 3, when should I get a pap smear? It is normal really to start pap smears when you're about 21. I bet you're glad to hear that. But pap smears used to be done annually, but now you might be able to even wait 3 to 5 years between that dreaded exam. Usually while you're still in your 20s, you will get a pap smear, but you will not be tested for HPV. But remember, even though you didn't need a pap smear, it doesn't mean you don't need an annual checkup on your contraception and your overall health. Number 4, why is sex sometimes or always painful, or why do I have pain in my pelvic area? It's interesting that according to a Princeton University study, 75% of women will experience pain during sex at some time in their lives. These changes can be very minor or can be very severe, disabling problem. Many minor issues can cause pain during intercourse, such as infections or poor lubrication. But serious issues can be a problem, such as endometriosis, severe scar tissue, adhesions, and these can cause serious pain in the pelvic area, and it's important for your symptoms not to be dismissed by your doctor. I'm going to emphasize that again. The severity of your symptoms should not be dismissed by your doctor. I have had many patients who came to me when their doctor told them that their symptoms were normal, or just kind of said, well, that happens. It would be best to see your physician and discuss how bad these problems have become and get a diagnosis and treatment right away. Number 5, is it normal to have vaginal discharge, itching, or odor? So A clear or milky looking discharge is completely normal and should be of no concern. Your body normally washes old cells from your vaginal area, and this creates a normal environment and that slight milky discharge. Remember, it is completely normal to wonder if your vaginal smell, itch, or discharge is normal. Every woman has a different discharge and smell, which often depends on what you eat and drink. Strong foods such as spices and alcohol can actually sneak into the vaginal secretions and create intense smells. But because this problem can be embarrassing, you often don't ask your doctor about it. Just ask them. But if the discharge changes color substantially, increases in volume, a severe itch, or a really bad odor such as a fishy odor, it could be a concern such as an STD, bacterial vaginosis, trichomonas, or a yeast infection. The good thing is your physician can treat any of these kind of issues. Number 6, why are my periods so heavy or irregular? Remember, it's very important to know that your periods typically about every 28 days. But there's a normal interval that some women can have, and it can be anywhere between every 21 days to every 35 days. And typically they last anywhere between 2 and 7 days. But they really can fluctuate from light to heavy based upon hormone levels, your activity level if you've been exercising a lot, and your diet. Extremely heavy periods can cause serious problems. So if you need to double up on your pads or tampons, change them every 2 hours because it's so heavy. You've been diagnosed with anemia, or your periods are lasting more than 7 days. This could be a medical condition called menorrhagia. Irregular periods can have many causes, even something more serious such as polycystic ovarian syndrome. But the most common cause, as you would guess, is pregnancy. So always make sure that we get that ruled out. So these can be serious problems, and you need to be addressing them with your doctor. There are good medical treatments for all these kind of bleeding issues. Number 7, what are my options for birth control? And is the birth control pill safe? Well, there are many options for birth control, including over-the-counter options such as condom, diaphragm, sponge. There are also prescription options such as vaginal rings, birth control pills, IUD, Implanon implants, and injections such as Depo-Provera that come with only minor risks. But the simple fact is that up to 30% of women using birth control pills quit them because of side effects such as nausea, which is very common, breast tenderness, headaches, mood changes, and even one that you may not know, a decrease in sexual desire. So remember, the only method of birth control that is 100% effective is abstinence. So it may be good to use the pill, especially if you want to protect from STDs, to use a condom. So even if you decide on a birth control method, it may still not be right for you. Another visit back to your gynecologist may be important to understand what's right for you. So talk to your gynecologist who is trained in contraceptive knowledge. Well, if you like this content so far, hit the like button and subscribe so you won't miss any of my new medical videos coming out every week. Number 8, how often should I be tested for sexually transmitted infections? And how do I know if I have one? What do I do if I'm exposed? So sexually transmitted infections can lead to serious, disabling problems, such as chronic pelvic pain, infertility, and even cancer. But they're extremely common. Approximately 20 million new STIs, which is sexually transmitted infections, and we'll use both of those terms, will be diagnosed each year. I think the main thing to remember is don't let your anxiety, your shame, or your embarrassment keep you from seeing the doctor. They are not there to judge you, and it is important to recognize pelvic pain that has come on quickly, and it's often even associated with a significant vaginal discharge, bumps or pain around your genital area, or even some burning down there. Unfortunately, even if you're married, you should be tested for sexually transmitted diseases because infections such as chlamydia or HPV can be very silent, yet cause major pelvic damage and infertility. Talk to your doctor about testing options that will be right for you in your age group. Number 9, what is the best time to get pregnant? What can I do to increase my fertility? So it's so important to understand the best time to get pregnant is about mid-cycle. And as we talked about before, the first day of your period is the beginning of your next cycle. And I know that seems odd, but your period is the end and the beginning of your cycle at the same time. Typical ovulation is again that day 14, but your period starts and it can vary between 11 and 21 days. So you can ovulate anywhere in there. It is good to use a fertility tracker, and many of those are available online, or you can use a home fertility test, but I've really found them to be pretty expensive. After stopping birth control, it is very likely to have irregularity for a few months, and it may be difficult to know when your ovulation may start in this scenario. You can increase your fertility, but maintaining your health and taking good supplements such as folic acid and prenatal vitamins is important. But it's always important to remember, if pregnancy has not happened within 6 months of you really trying and you know you've had regular periods, it's certainly a good time to talk to your gynecologist about a fertility workup. Number 10, what is a urinary tract infection and how to know for sure that I have one? So often when you pee, there is a burning sensation when you void, as well as an increased urgency to get to the bathroom, and you go often. And these are really the normal symptoms of a urinary tract infection, which is called a UTI. We may also call it a bladder infection. So those are the same thing. An odor could be present as well, but certainly just increase the amount you're drinking, and that could help. But if symptoms persist, you may need treatment with antibiotics. Often bladder infections can also be associated with sex, and antibiotics can be prescribed to prevent infections from reoccurring. So we're nearing the end, and I promised you one more if you stayed. Thanks for staying. Here's your bonus question. When is the first time I should see my gynecologist? You know, many teenagers visit their gynecologist for all sorts of things, typically brought by their mother, and birth control, bleeding, and painful periods are common. But you know, really there's many physical changes that are happening during that early time, and you can discuss this with your gynecologist and really what it means to you. An actual pelvic exam with pap smears typically is not done, as we noted before, until 21. But there may be other problems that may necessitate a pelvic exam, but typically we don't do it. So don't be fearful of that. So most young women are glad to hear that that may not happen, even if you have some irregular problems there. Just understand, gynecologists are trained to make you feel comfortable, and they should. So this is a series of videos exploring a few of the right questions to ask your gynecologist. I hope you have enjoyed it, because I certainly have enjoyed being here with you. But please comment so I can know what is bothering you and what problems are on your mind. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it is okay to reference the information I gave you. Thank you.